Microcephaly is a rare neurological condition where an infant's head is significantly smaller than the heads of other children. This disease is usually detected at birth. And some children will have normal intelligence and development. This disease is usually the result of the brain developing abnormally in the womb or not growing as it should after birth. A child with more severe microcephaly may also have a backward sloping forehead. Other causes of microcephaly include craniosynostosis, the fusing of the joints or sutures between the bony plates that form the skull to keep the brain from growing. Decreased oxygen to the fetal brain, where certain complications of pregnancy or delivery can impair oxygen delivery to the brain. Also, infections of the fetus during pregnancy. Exposure to drugs, alcohol, or certain toxin chemicals in the womb. And severe malnutrition. Depending on the cause and severity of this disease, complications may include developmental delays like speech and movement, difficulties with balance and coordination, dwarfism, facial distortions, hyperactivity, and seizures. Except for surgery for craniosynostosis, there is no treatment that will enlarge a child's head or reverse the complications of microcephaly. Early childhood intervention programs that include speech, physical, and occupational therapy may help strengthen the abilities, and seizure and hyperactivity can be treated with different medications.
Addison is our first child of 5. It was until she was about 1.5 years that we really knew things were going on. She did have microcephaly, which meant that her head was not measuring within normal limits.
Microcephaly is a condition where the brain fails to achieve its normal size. Consequently, they don't work quite as well. They often have particular difficulty with some of the really high-level functions like language.
There are many causes of microcephaly, both conditions that can occur before birth, during the birth process, and after you're born. For instance, infections can cause microcephaly. But there are also many different genetic conditions as well.
We started meeting with a neurologist and she had a seizure at 4 months. But both of those conditions, the doctors told us could happen in a typical child.
We had a referral to a geneticist. He thought it was not a genetic issue, but it was just more of a random occurrence. And at that time they said, look, it's probably a pretty good likelihood that you're not going to know, what the root cause of this is in your lifetime. The technology and the science probably just isn't going to be available. And so we just went about our lives, as best we could. Had 2 typical boys, and that supported the data that we were getting at the time. And it really wasn't until we had our 4th child, Brooks, that it was evident he had the same condition that his sister Addison had. Now it is a genetic issue and an inherited issue. And that's what really led us to the people here at Boston Children's and the Walsh Labs.
The Lennons came to see us because they had just had a baby boy that suffered from microcephaly as well as having seizures, and they recognized this as the same problem that their daughter had also had. They were very, very eager, as you might imagine, to try to understand the cause of this condition.
It was an amazing experience for me as a mom because when we met with this group of doctors, it was the first time that I actually felt like, you know, if we don't even know what Addison and Brooks have, at least we can feel like we've done everything that we can. These doctors were just amazing and took the time, all of them in their different specialties, to get to know our case.
My wife and I certainly had a peace of mind that we could go anywhere in the world and not find more competent, better doctors than what we found here at the Walsh Labs.
We were able to find changes in their DNA and able to correlate those changes with abnormal cell function. And at that time that we were confirming this, they called us to tell us that they were expecting another child.
While we certainly were very happy about it in ways, we were very fearful, obviously.
Brooks had had such a hard time his first year and a half that I, as a mom, had a hard time coming to terms with the fact that I might knowingly bring another child into the world that could have those challenges.
We found ourselves reaching back out to the Walsh Labs, find out if there was, a test that could be done to determine whether or not the child was going to be affected with the genetic condition. My wife and I fully expected that there was not going to be a definitive test, and to our very pleasant surprise, they got back to us and said, absolutely, we know exactly where to look.
When she was 11 weeks in utero, we were able to test her, and she did not have the condition.